Hello great mothers, how are you? May we all always be healthy and blessed by God. Amen. Let me introduce myself. My name is Putri Intan Purnama and I'm from a 4th semester Diploma for Midwifery student at Tasikmalaya Ministry of Health Polytechnic. Okay mom, today I will present a presentation on a topic. This is related for breastfeeding mothers, namely breast inflammation or mastitis. Mom, do you know about mastitis? Have you ever wondered the breastfeeding provides benefit for both mother and baby? Unfortunately, mothers may experience several problems during the early stages of breastfeeding, one of which is mastitis. I have divided my discussion into several discussions, namely the first is definition of mastitis, second, causes of mastitis, third, symptom of mastitis, fourth, diagnosis of mastitis, fifth, prevent mastitis. Okay, the first is definition of mastitis. Lactating mastitis or mastitis is inflammation of the breast tissue which generally occurs in breastfeeding mothers. Mastitis usually occurs in one breast, but it is possible to occur in both. This condition most often attack mothers in the first 6 to 12 weeks postpartum. Mastitis can cause severe pain, causing suffer to often stop breastfeeding due to the discomfort in mother. Even though mastitis is a condition that is not dangerous from the baby, so mothers should continue to breastfeed slowly because your baby needs exclusive breast milk, which contain antibacterial compound to protect him from infection apart. From that, breastfeeding can also speed up the healing process of mastitis. The second point is causes of mastitis, and the main causes of mastitis is clotted milk duct, and the several factors of clotted milk duct, namely mom doesn't produce too much breast milk. The second, breast milk is not expressed regularly. The third, the lacting position of the baby's mouth when breastfeeding is not correct. Fifth, the process of weaning a baby is two-phase. Sixth, the baby is not breastfeeding enough. 7. Too often using only one breast for breastfeeding. And the next point is symptom of mastitis. The symptom of mastitis, the first, is a persistent inflamed breast pain or while breastfeeding. The second, pain when the breast is touched. The third, swelling in the breast. Fourth, redness of the skin of the breast and the breast feel warm. Fifth is fever. Sixth, persistent inflamed breast pain or flu-like symptom, namely chills and fever. 7. A burning sensation appears in the breast when breastfeeding. Okay, let's move to the fourth point. This is any diagnosis of mastitis. Establishing a diagnosis can be gained by carrying out an anamnesis or medical interview to find out the patient's symptom and several health history. They then continue with carrying out a physical examination to detect whether or not there are lumps in the breast, as well as other physical signs, then carry out several supporting examination. There is first is breast USG. It's to check for lumps in the breast, and the second mammography used to check for sign of breast cancer. The third breast biopsy this is done by taking a sample of breast tissue for examination in the laboratory. And the fifth is blood culture, an examination carry of if mastitis continue to occur or get worse. This is aimed to find out the bacteria that causes infection. Okay, next. I'd like to focus in this point that mastitis is a condition that requires treatment as soon as possible so that the mother can feel comfortable again when breastfeeding her baby and prevent serious complications. This is a problem and we need to be prevented. So the last point is how to prevent of mastitis. Okay, to preventing of mastitis, the first is frequently breastfeed the baby direct breastfeeding to empty the breast. The second, try to pump breast milk frequently to avoid clogged milk duct. Third, breastfeed using both breasts alternately. Fourth, use a warm compress and massage the breast before and after breastfeeding or pumping breast milk. Fifth, avoid wearing breasts that are too tight. C. Fulfill nutritional needs and get enough rest. 7th, fulfilling body fluid needs. 8th, wash your hand regularly and clean your nipple before and after breastfeed. 8 and 9th, consult a doctor regarding appropriate breastfeeding technique. Okay, Mom, that brings me to the end of my presentation. Before I stop, let me just to sum up that mastitis is inflammation of breast tissue due to a collagen milk duct, which causes symptoms of fine in the birth, which generally occurs in mothers in the first 6 to 12 postpartum. To conclude, mastitis commonly occurs in postpartum mothers and causes uncomfortable symptoms for the breastfeeding mothers. Okay, thank you for your attention. I'd be glad to answer if you have any question. You can write in the comment column and I will try to answer them. Wassalamualaikum warahmatullahi wabarakatuh. Thank you. Bye bye.